Hello out there and welcome. My name is Stacy Sanderson. I am an author, speaker, and registered psychotherapist as well as social worker in Ontario, Canada. And I'm here today to speak about narcissism and substance use. Now, I realized after speaking with a client last week that this may have been a chapter I missed in the book, but that's okay. No time like the present to talk about it. One of the things I spend some time elucidating is the difference between narcissism and narcissistic personality disorder, the definitions of narcissism, and the diagnostic criteria for narcissistic personality disorder, because I do think that the diagnostic criteria is being used out of context. I also don't think that the criteria is up to date, accurate, reflective of different genders, certainly not reflective of the female manifestation of narcissism. But I digress. With narcissistic personality disorder, it is often comorbid with another condition. It's on axis 2 in the Diagnostic and Statistical Manual, which means that above that on the list, if you will, is often a comorbid or coexisting condition. I think the most prevalent one would be substance use disorder, which you could also label addiction or alcoholism. So, not to make things confusing, but I think that substance use, particular disorder, sorry, not substance use, but addiction, substance use disorder, substance dependence disorder, people who are struggling with addiction by virtue of that suffering tend to be quite self-absorbed, right? Their battle with addiction in and of itself is self-absorbed. I remember learning many years ago that when people are addicted, their first relationship is to the substance. But I would add on to that that their first relationship is with themselves and that struggle. So, if we consider the prevalence of the comorbidity of substance use disorder and narcissistic personality disorder, I think that there's a salient aspect to being in relationship with someone who's not only narcissistic, but struggling with addiction. Um, Anecdotally, I would share that I quite often hear that, when clients are in a relationship with a narcissist, they do tend to also struggle with substances. So I suspect this substance dependence is all about self-soothing due to that emotional dysregulation they tend to experience. There also can be an impulsiveness or a recklessness and a blatant disregard for the social norms, rules, and legality of substance use, right? So basically, I'm saying they really don't give a rat's ass about what anyone else thinks or even what the law is. So there are significant barriers to someone who has NPD or who even is narcissistic to be focused on healing that addiction or changing their behavior. So it's been my experience that people with NPD or who are high in narcissistic traits, that the only thing they can get from therapy is behavioral change. So if you want to disagree with me, go ahead and please add that in the comments. But that is my experience. And often that behavioral change is motivated by a power greater than them. So what I mean by that is they may come to therapy if they're court ordered. Or if they've been mandated by their employer. I used to observe that many years ago when I worked in more of a public mental health capacity in primary care. We would get people who were court mandated to work on their addiction because there's not a significant value base for them to be motivated to do it on their own. So back in the day when I was teaching motivational interviewing, considered to be one of the most popular, I'm not sure about efficacy, but certainly motivational interviewing is the gold standard for treating addiction. And it is an incredibly useful modality. And part of that is helping someone anchor into what's important to them as a motivator for change, right? Not used in a manipulative way, not by any means, but you would have someone who's struggling with addiction really think about what matters to them and integrate into that reason for change. Okay. So this is complicated then by someone who's narcissistic, who lacks self-awareness, lacks other awareness, who would not be able to have insight about how their addictive behavior is affecting other people. The only time you would get them to change would be if there was a significant threat, and particularly a threat to their ego equanimity, right? A threat to the perceptions of how people see them is going to be one potential motivator. There's a real dilemma in terms of how alcohol, particularly, or other substance, less so, I would say, um, keeps the narcissist stuck in their grandiose delusions, and more often than not, keeps them in a victim state. So if you're already in a codependent relationship with a narcissist, the substance use is going to add on another layer. I am saying alcoholism because that's the one I hear the most often. But this could, of course, also be cocaine, but I hear this much less about cannabis. Cannabis is the substance for the rest of us. I'm just kidding. I'm just kidding. Keeping in mind that substance use can make people increasingly insular over time. And any substance use can also exacerbate the mood instability, recklessness, impulsivity, self-absorption that narcissists already have. So you hear me sort of serving up some different ideas here with respect to the comorbidity of NPD and substance use disorder, to use the technical terms, but also how substance use is in its own way an element of self-absorption. All of this to say, it is much more difficult for people with NPD to change their substance use behavior, particularly if a loved one is asking them to do so. I would suspect that substance use is all part of the narcissist's entitlement. That they're entitled to do the things that help them to feel better. Much like a toddler is entitled to a treat when you're going through the checkout at a grocery store, right? It's there and I get to have it. I think that substance use, or in particularly intoxication, also complicates narcissistic behavior because it is integrated with their own self-esteem cycle. And I'm going to say that a little bit differently. So all narcissists experience what I refer to as the shame vulnerability vortex. They have intense defense mechanisms against shame, and they do not like feeling vulnerable. And I think that substance use weaves into that cycle. So that is to say that they're going to use more, or they're going to use intoxication to deal with those difficult things. The other thing that's going to happen here is a concurrence between the mood cycles of addiction or substance use and how the narcissist swings from grandiosity to despair. So, in substance use, and most of us have observed this, people's mood can be neutral and then it goes slightly up toward euphoria as they anticipate using a substance. It might go up a little bit more, it might flatline then, but then it's going to quickly drop away as the substance starts to wear off, right? So this is all about serotonin and dopamine cycles in the brain and how any kind of substance use very much influences that. So if you've lived with an alcoholic, for example, you know exactly what I'm talking about. And I think that that mood cycle can be greatly exacerbated by someone who's narcissistic. Now, I'd be interested to know if anyone else has experienced this, so please drop this in the comments. I also think people with NPD, or even people high in narcissistic traits, are more prone to use substances secretly. Maybe due to shame, maybe so that people have a different view of them. I have met many narcissists who are highly judgmental of other people who use substances to the point of, condescension or devaluing and dismissal. But I do think they, especially the covert ones, are more likely to use substance secretly or to deny that they're doing it at all. Now, you can also have a grandiose narcissist, and I know there's sort of a myth out there that they can drink more than most people, and that might be true. On the grandiose end, you might have people making a bigger show, like getting bottle service or, ordering an expensive wine at the restaurant table. But where I'm going with that is the covert or overt tendencies are going to influence the way substance use manifests in someone's life. So the interesting thing here is that NPD is made worse by substance use, and substance use is made worse by the traits of someone's narcissism, mainly because the way that we care about other people and the impact of our behavior is not something that tends to be an issue for them. That all being said, substance use is often the gateway for narcissists to land in some type of helping capacity. That and anger or violent behavior or depression. So please let me know if any of this resonates with you or if there's anything that you would like to add. If you are subscribing, let me know that in the comments because I would be so open to having a conversation or direct messaging or hearing about your experience. So I hope that I, these ideas has been useful to you, and I look forward to connecting with you in the next recording. Take good care.